built we have built this plan
Sorry, Angie, I
out.
forgot to tell everybody this is going to be recorded.
Yes, thank you. So we have built this plan with bells and whistles that you can't get in standard plans. We've also made this plan a passive plan, which means it really doesn't have an in and out of network benefit. If your providers today accept Medicare, then you shouldn't have any issues seeking them going forward. There is not an in and out of network benefit. You can continue your services that you're already having today. They would just be subject to the benefit level under the Medicare Advantage plan. Um, Being passive, I will tell you that I am not even aware in the state of Michigan of a provider that doesn't accept the Blue Cross Blue Shield Group Blue PPO. And across the United States, I'm only aware of two instances where the providers don't accept a Blue Cross Blue Shield Group Medicare Advantage plan. The first one is the Villages in Florida. That's a retirement community that has its own healthcare system, and they truly only accept Humana Medicare Advantage. They don't even accept Original Medicare. The other one that I'm aware of that does have issues with group Medicare Advantage products is the Mayo Clinic, but those services are available at other locations. So those are the two that we're aware of that do not accept the group passive plans. The other thing that I will note is that the formulary that we're using for the medications is the largest formulary that Blue Cross Blue Shield has in its group menu. It is the custom enhanced formulary. We will put some links in the chat for you as Michael's talking so that you can reach out to our office if you have any questions. We'll put some lists in there as far as the formulary that you can go ahead and open up and grab. And then also there will be a discussion of standard benefits versus preferred benefits for pharmacy. With that being said, I do want to note too, and I know Bridget would mention this if I didn't. So those who are Medicare eligible or Medicare enrolled, every year if you do want to purchase on a voluntary basis the dental and vision plans that the county offers, you do need to submit the enrollment forms. So every year the cost could change. And if you do want dental and vision, those forms are due by Monday. So please get them to the county, either drop them off or mail them.
Thanks, Angela. And if you did not receive those forms, shoot me a message, either in the chat or shoot me an email, and I can email you those forms. It's really important to remember that you have to enroll in that every year. And the main reason is not just because of the cost of the plans could change, but it's a voluntary benefit and you are paying for it. And it's coming out of your pension check. So if you think, gosh, I really didn't see the benefit for that this year, I'm not going to re-enroll, that's okay too. But we will not automatically re-enroll you.
Perfect. Thanks so much, Bridget. All right, so I'm going to put myself on mute, and we will have Michael Chavis from Blue Cross Blue Shield jump on and review the benefits. Remember, save questions to the end. You'll be able to ask them openly, as long as it's a generic question, not member specific to a medication or a condition. And then we'll be watching the chat as well at that time. So, Michael, you're up.
Thank you so much, Angela. Good afternoon, everyone. I'm Michael Chavis with Blue Cross Blue Shield of Michigan. Thank you all for coming. We appreciate being here. We will go through the presentation and give you information about your upcoming plan and reference to your current plan and how they differ, how they're the same, and help you navigate through them. So with that, please follow along. Next page. We'll look at the agenda that we'll be going over today. Okay, thank you. So the agenda for today is going to be Medicare basics, getting started, going over the benefits of the plan for the medical benefits and copays, along with the prescription drugs benefits and copays, and other health and wellness programs like silver sneakers and other things that you may have heard of, be familiar with. Some you have today, others you don't. So Medicare basics. We'll spend a bit more time on these first slide or two, kind of building our foundation, and then everything else will kind of flow much quicker after that. So if you can bear with us, here you'll see what looks like a math equation. On the left side of the equal sign, it starts with original Medicare. So that includes Part A as in Apple, which covers your hospital benefits, skilled nursing, hospice, home health care. Now, the cost for Part A, like Apple, is been satisfied during your active employment. When you had payroll deductions and a little bit was taken out every pay cycle, part of that went towards the payment of original Medicare Part A. So working 10 years full time or the equivalent of 40 quarters over your lifetime, you will have exhausted and paid for original Medicare Part A. Original Medicare Part B, as in boy, includes the benefits for your doctor visits, your mental health care, lab tests, durable medical equipment like canes, crutches, wheelchairs, walkers, and so forth. Diabetic equipment. Now, your payment for Part B is normally done by automatic withdrawal from your Social Security check. It's deducted there. There's a monthly premium, and that premium is paid to the federal government. So CMS, the Center for Medicare and Medicaid Services, is a part of the federal government that oversees original Medicare. Original Medicare, think of the red, white, and blue card that you have. It has on it Part A and the date you enrolled in that. Part B, as in boy, and the date you enrolled in that. So again, that's original Medicare, your red, white, and blue card. Moving to the right side of the equation, you'll see Medicare Advantage, also known as Part C. Now, all of the letters, Part A, Part B, Part C, Part D, these are all given by Blue Cross. I'm sorry, stuck that. They're not given by Blue Cross. They're universal, and they're given by CMS, Center for Medicaid and Medicare Services. So it's universal, regardless of the carrier. So you'll hear these. The interchangeable Part C and Medicare Advantage, it gives you all the same rights, benefits, and protection that you receive in original Medicare, plus some, like silver sneakers. That's not included in original Medicare, but you'll have in your plan effective 1/1/25. So you'll also note at the bottom of Medicare Advantage or Part C, it says you must continue to pay your Part B premium. So that premium is paid again to the federal government, not the Blue Cross, not to the county. You will continue to pay that. Now, what's some of the differences? On the left side of the equation, today, with original Medicare, when you go to the doctor, hospital, pharmacy, you present your original Medicare card, the red, white, and blue card, and you present your Blue Cross and Blue Shield card. The reason for that is because both entities are paying part of the claims. Subsequently, you also receive an explanation of benefits whenever services are rendered. You receive that from both entities, CMS and Blue Cross Blue Shield of Michigan. You reconcile those for accuracy, and that's the way your information is shared in terms of your claims, your explanation of benefits. Under the fully insured Medicare Advantage plan, you'll only get one explanation of benefits from Blue Cross Blue Shield. You'll only present your Blue Cross and Blue Shield card when you go to the doctor, hospital, or pharmacy. So the reason you can receive the similar benefits, and in some cases more enhanced, like silver singers, at advantageous rate compared to where you are now, is because the federal government provides a subsidy to offset the cost and to pay providers like Blue Cross and Blue Shield of Michigan to administer these Medicare Advantage plans on their behalf. They provide the guardrails, the guidance, the instructions. They basically tell anyone who wants to administer Blue Cross or administer Medicare Advantage plans, these are the rules, this is how it must be done. So as we proceed throughout the presentation, I will continue to refer to CMS because they're the ones who provide most of the requirements as to the way these plans are administered. So also noteworthy here, you have to the far right, Medicare Part D, the final column on this math equation. So think of Part D as standing for drugs, and it represents your prescription drugs, as it says. So it's not a separate payment. It's not a separate enrollment. It's I say it's like ragu. The Part C of Medicare Advantage includes the Part D. It's all included together. Now, CMS, again, some of the rules of engagement. You can only be enrolled in one Medicare Advantage plan at a time. You can't be enrolled in more than one. The plan that you enrolled in last will take precedent. CMS will automatically disenroll you from any prior plans you enrolled in. So, say you have a spouse that has, because you're married to your spouse and they have access to their former employer or current employer to a Medicare Advantage plan and you're enrolled in it, you have to make a decision which plan you want to be enrolled in. You can do that by comparing the benefits at a glance, see what the benefits are, what are the costs to you, and make a decision as to what's in your best interest. But understand you can't be in both plans at the same time. Also, all Medicare Advantage plans are administered on a per person basis. So it's per individual, even if you're married or have dependents, it's not considered a family plan. What that means is each person will receive a new Medicare Advantage card, a new ID card, prior to the effective date of 1/1/2025. The new cards will come in each person's individual name, and all of the benefits and the copays will be tracked individually. So we'll refer to that as we look at the medical and the prescription drug benefits throughout the presentation. Also, trying to think of what else is noteworthy here. So again, you can only be in one plan at a time. The plan you enrolled in last takes precedent. You don't need to enroll into the Part D. It is already included. There's no additional cost to you. And yeah, everything is administered on a per person basis. So next, we'll look at some of the details of the plan. So some of the documents. You should have received what we refer to as a pre-enrollment kit from Blue Cross and Blue Shield of Michigan. The fact that you're on a call here means that you had to at least get the letter from the county letting you know they're going to make the change and to attend one of these meetings for more information. After that package was received by you, should have gotten a pre-enrollment kit, which is represented on the left side of this page. In there would have been the benefits at a glance and an opt-out form. If you didn't receive that pre-enrollment kit from Blue Cross and Blue Shield of Michigan, and again, each person should have received one. So even if I'm married, if my spouse is also Medicare eligible for the plan, they should have gotten a separate pre-enrollment kit addressed to them with those same documents, benefit at a glance and opt-out form. If that did not occur, then please let us know. You can put it in the chat or talk to us during the Q&A session at the end, because we just want to make sure that everything is on track and happening appropriately. Now, if everything is on track and then you do not have to take action to enroll into the Medicare Advantage plan. You will automatically be enrolled effective 1/1/25. You'll see on that left side next with the pre-enrollment documents, in addition to the benefits at the glance, you would have received an opt-out form. That opt-out form is only used for you to decline coverage. So unless you're saying, no, thank you, County of Midland, I do not want to have coverage offered by you for medical or prescription drugs, then you don't have to do anything with that form. You can discard it. You don't have to do anything with it. No action is required. Again, you'll automatically be enrolled. You will receive a new ID card. Each person will get their own ID card with their own name on it after 1/1/25, and those cards will come out prior to 1/1/25. So you'll get them between now and then. You should have also probably gotten a letter by now that actually refers to your ID number. With that ID number, you can obtain services even without the actual physical card. If you don't have the card by the end of the year, then reach out and we'll see to it that you get it. After the enrollment 1/1/25, you'll have post-enrollment documents. Those will include the welcome letter, the evidence of coverage. The evidence of coverage is your most itemized and detailed document that gives you information about the benefits of your plan. So today we're going to go over a couple pages at macro aggregate level. The benefits at a glance you receive gives you more details as to the benefits and the copays associated with each, but the evidence coverage is the most detailed. So you'll be getting a copy of that after 1/1. It'll be mailed to you. You'll also get a resource guide from Blue Cross, which gives you pertinent information and best practices that you can follow. Okay, next page. This talks about some telephonic or online enrollment. Again, you don't have to be concerned with that. You're going to be enrolled automatically as long as you've gotten those documents that we talked about. Next page is a copy of your Blue Cross and Blue Shield card and the version that you'll have on the new one. You'll notice on the left side, the front of the card, it says Medicare Plus Blue Group PPO. That's the name of the plan. The lower middle, it has a suitcase. Inside of that, the letters MA for Medicare Advantage, and then PPO at the bottom. That's a preferred provider organization, which means there's no need for a referral to go see a different doctor, a specialist, or a hospital. You can go to either, to any doctor or hospital. It's a PPO plan, so there's only one copay. It's a passive plan, so only one copay. There's no separate cost for going to one hospital or doctor versus another. On the right-hand side, it's a picture of the back of the card, which gives you several 800 numbers for you to call, whether it's provider information, you're going out of town, you want to know where close providers are, or member services if you need an ID card or have questions on claim, or just other information. Next, it talks about different information we'll be sending out to you. So we talked about the welcome call and the ID card. You're going to get those. There's a health assessment document that's sent out to you, which is intended to get information so that we can properly inform you and expose you to benefits if they could be of help. So, for instance, if I'm a smoker, I want help stopping, I'm open to it, then there's a confidential, no cost tobacco cessation coaching program that's available online. When I fill out the health assessment, I can make note that I'm a smoker and then that information be shared with me. So I'll make sure I'm not missing out on anything. You can have your doctor assist you if you like in going over that. You don't have to fill it out, but just know that uh, in no instance would you ever be penalized, charge a higher premium, or have your services interrupted at all because of the health assessment. You also get a coordination of benefits survey that we'll talk more about. That's listed here. That's important that you fill out and return so that all your claims continue to be paid. And you'll have an annual member magazine that'll come to you, which is just a great resource with some best practices, things that you can do during different seasons, again, to enhance your experience with the plan. Now, explanation of benefits on page 10, if you're following along. The explanation of benefits is available for both the medical and any prescription drug services. No services incurred, no explanation of benefits to be provided. You can always opt out of the hard copy and just access it through the mobile app or online, but the tracking of all your costs and payments will be done through the explanation of benefits. We encourage you not to make a payment, even if you're billed, before you get the explanation of benefits. It should come out within 30, 45 days of any services that you have. This is December, still earlier in the month, the 11th. So if I went to the doctor earlier this month, I won't have my explanation of benefits yet, but I would probably get it by the end of January, certainly in the month of February. You want to receive that and have an opportunity to review it for accuracy and completeness, making sure you note that the service provided is correct, how much was billed to Blue Cross, what amount did Blue Cross pay on your behalf of the claim, and what, if any, amount you're being asked to pay. Once you're comfortable, you reviewed it, it's accurate, then you can make your payment. If not, you have questions, then reach out. That way we can make sure you're not being overcharged or something was amiss. Next on page 11, this breaks down some of the vaccines that are available and just distinguishes them between being under Part B of Original Medicare or Part D, the Medicare Advantage Prescription Drug Plan. You'll see that whether it's shingles and meningitis, hepatitis A, those are covered under Part D for drugs, and then the pneumonia, the influenza, hepatitis B, and the COVID-19 vaccines are administered under Original Medicare Part B, as in boy. So let's look at some of the costs for the medical plan. The medical plan, the costs can be categorized as deductible, co-insurance, co-payments, out-of-pocket max. Your plan has a deductible of $500. That's the amount that you pay before the insurance company pays. Your co-insurance is $0. Your out-of-pocket maximum is $1,500. The office visits, the other copays for your medical. Office visits is $30 for your primary care physician. If you're going to see a specialist, it's also $30. The chiropractor is only $20. The emergency room is $100 per visit. $100 unless you're administered into the hospital as a result of that ER visit within 3 days. So if I go in today, they keep me overnight for observations, for monitoring, and then sometime tomorrow, Thursday, they say, okay, we're gonna go ahead and admit you, give you a room in the hospital. Okay, now that ER copay of $100 would be waived. Your urgent care visits are only $35, and the ambulance service, as long as it's medically necessary, is $75. Next, we look at durable medical equipment. So I mentioned things like prosthetics and wheelchairs, walkers, braces, so forth. They also have some of the diabetic supplies like insulin pumps, strips that are available through Northwood Institute. The Northwood customer service number is listed. You also can get things like your glucose monitoring
There it is.
and other tools that you need. Next on page 17, if you're following along, are prior authorization programs. So I think the key takeaway here is that if a prior authorization is needed, you're being made aware of it, but the actual securing of it, the lobbying, the processing of it will occur by your doctor. They'll be working on your behalf as an advocate to obtain the prior authorization for certain medical procedures. If it's not approved, there is an appeal process so that things can be reconsidered, more information can be provided. So finding an actual provider. I mentioned that it's a passive plan, so the copay is the same whether you're in Michigan or California, Arizona, Florida, or out. So there's the same copay regardless of the doctor or hospital you go to. So that's a passive network. There's no in and out. No referrals are needed, like with an HMO plan to go see a particular specialist. You can just pick the specialist. No one has to approve it. On page 20, the next page, how to find a participating provider. Again, there's various options. You can use the .com to navigate to the site and look it up yourself. You can use the customer service number on the back of your card, call toll free, get information there, or you can go to the mobile app. Download it for free, just like your weather app or your GPS, and then right on your phone, you'll have access to ID cards, explanation of benefits, find out where a local provider is to supply what you need. Page 21, it refers to online visits through Teledoc. And a lot of people have perhaps used the online visits today, so that's a benefit that you have. This is great when you are out of town, uh, maybe in a rural area, you're hunting, you have questions, you need service, but you don't have access to or want to go into a brick and mortar building and see someone face to face. You can set up time 24/7 to get help by a professional to answer your questions, to help you obtain some sort of diagnosis or recommendation on how to better the situation. So you can either go through the .com or the 800 number. This wouldn't replace any type of online reoccurring visits you have, like with your doctor, your primary care, anything like that. On page 22, the mobile app that we've been talking about is detailed there. Again, explanation of benefits, ID cards, the tracking of your copays that you pay out of pocket for pharmacy, prescription drugs, or medical. That's all done on the mobile app. You have access to it there. Next, you have the page 23 when you travel. So worldwide coverage is included for emergency and urgent care. You also have the enhanced foreign travel benefit, which was added to your plan for 2025. So even above and beyond what original Medicare would allow for that foreign travel uh, benefit is included. It is noted that in cases where, say, you're traveling, especially on a cruise or something, you may want to consider the health coverage that they offer because it will include some additional services, like, for instance, airlifting to a hospital and so forth. But otherwise, you have coverage for your foreign travel. So up until now, we focused on the medical coverage. Now, these following pages are going to talk more specifically to prescription drugs. The comprehensive enhanced formulary you have is the most robust and all-inclusive program for Medicare Advantage through Blue Cross. You have not only the access to the 64,000 pharmacies and 23,000 preferred pharmacies, you also have preferred and standard pharmacies that give you different copays. The lower copay is available at the preferred pharmacy. It's noted here 23,000 pharmacies. And in the upper right hand corner, some of the national name brand, most of them are listed here. So Costco, Kroger, Myers, Sam Club, Walgreens, Walmart, they're all listed, their preferred pharmacies. CVS, you don't see on there. They are included. They are in the standard pharmacy category, not the preferred. You'll never pay more than the standard copay, which we'll look at the exact dollar amounts on the next page. So on page 25, again, to kind of highlight the takeaway, there is home delivery available of your prescription drugs for a 90-day, 3-month supply. That shipping for the home delivery will be waived if you go with Optum or Walgreens. You're getting that 90-day supply. So on page 26, it talks about the formulary, the list of the drugs that are covered by your plan. With formulary, you also have the 5 tiers itemized out, and what CMS kind of labels those: preferred generic, preferred brand drugs, non-preferred drugs, and specialty drugs. The higher the tier number, like tier 5, the specialty drugs with a retail minimum cost of $800 or more, they go well into the thousands of dollars. Just again a 1-month supply. Just a 1-month supply. Now new for 2025 is the maximum out-of-pocket cost just for the prescription drugs. There's always been one. It's been phased down over the last few years. $2,000 is the lowest it's been. So you have an out-of-pocket cost of $2,000, not including the medical, only prescription drugs. The medical is $1,500 for the out-of-pocket max. Here is $2,000 just with the prescription drugs. So if you were to ever reach that threshold as an individual, then once you pay that $2,000, at whatever point in the calendar year, for the remainder of the year is covered at 100%. Same with the medical. If you ever reach that $1,500, the rest of the year it'll be covered at 100%. No cost to you. Next, on page 27, you have the itemized cost for the prescription drugs. So the preferred costs are either the preferred costs are either $2, $30, or $65, according to the tier, right? Tiers 1 and 2 are $2, tier 3 is $30, tiers 4 and 5 are $65. So I'm on page 27 now. The standard pharmacy which you should never be paying more than the standard pharmacy rate, is $7, 35, and $70. So about a $5 difference um, between each of those. And also it notes that that's for a 1 month supply. Either the 30 or I'm sorry, the two 30 is $65 for preferred, and then the 7, 35, and 70 for the standard. Also on this page 27 in the far right column, you'll note that the 90-day supply, the 3 month supply, you're paying for only 2 months. So you pay for the 2 months, you get kind of the third month for free. So there's a benefit if available. That 90-day supply is not available for your specialty drugs, tier 5, but it is for tiers 1 through 4. And you also see that threshold, the worst case scenario, the maximum out of pocket is listed as $2,000 at the bottom of the page. Keep in mind that $2,000, that's per person. If it's a husband and wife, the amount of copay out of pocket cost that I spend will go towards my out of pocket max, and then my wife, the out of pocket max will go towards hers, towards her the own threshold of $2,000. On page 28, if you want to see an example of what the formulary looks like, this is it. This is a snapshot from a page. So you can see the tier 3 and 4. That's listed as well as PA for preferred. So or no, PA for prior authorization. So you can connect the dots as to what your payment would be if you find your drug listed in the formulary and then what tier it's in, 1, 2, 3, 4, 5, then you can determine whether you're at a preferred pharmacy or a standard, and you know exactly what your cost would be for your prescription drugs. On page 29, you have clinical edits listed. These are things that you're probably familiar with. They're in the prescription drug plan you have today. They help to keep the cost of drugs down. Prior authorization may be so that certain drugs, if used by the same person, commingled, they might have a negative or pretty bad impact. So prior authorization will be required. Opioids, the opioid epidemic and high cost require certain prior authorization to be done when deemed necessary. Step therapy, that's going to be where you might have a brand name where the cost is pretty high, and then a generic comes out within a short period as soon as the patent, if there is one, expires, and then that may, without doing the math, require a person to say if there's a generic drug, lower cost, use that or start with that as compared to the brand name drug. And then quantity limits are going to be for those high cost drugs like specialty, where the cost is really high, or maybe instances where the shelf life is short and uh, maybe refrigeration is required. The drugs, they probably won't allow them to be prescribed for 90 days, sometimes less than 30 days, 10 or 14 days, depending. So on page 30, this gives you some pointers and ways not to have challenges with any disruptions in your prescription drugs. So this is December. My suggestion would be if you have prescription drugs and the ability to get a 90-day supply, they're not a tier 5, they're tier 1 through 4, then getting that 90-day supply, that's going to give you an automatic 3 months that you have kind of in reserve. You also, even if the drug is not included in the new formulary in January, by use of what's called in that first paragraph there, transition prescription fill, as long as it's a prescription that you've been using over the past 90 days, you've gotten it refilled, then you can get an automatic 1 month refill. So everything's been done so that you don't have any disruptions during that 1 month. If you just use the transition uh, fill, or ideally 4 months, if you can add 3 more by getting a 90-day supply now, you can work with your doctor to see if there's an alternative drug, maybe a generic drug. It could even cost less than what you're paying today for the brand name, or they can work in the appeal process if they deem it appropriate to have that drug added to the formulary. Just say, for instance, if it's not covered. On page 31, there's additional items, information about that avoiding pharmacy disruption, more details on that transition fill. You have first 100 days of the plan to get that 1 month supply. Um, on page 32, you have some documents here coming up where if you receive them, these are CMS requirements. You'll need to follow the instructions and then take action accordingly. Sometimes the instructions are not worded as clear and simple as we might want. They could be sometimes confusing. If you have questions, feel free to ask. Please reach out Brown and Brown to the county. We can help direct you, Blue Cross, as to what is being asked for you to do. So this late enrollment penalty specifically says two things. One, if you do not have credible prescription drug coverage prior to entering the plan. Well, for all of you, you do have coverage. You're covered today under a Blue Cross and Blue Shield plan. It is credible coverage, so no challenge issue there. Also, if you were to ever have, either now or in the future, a lapse in coverage that is 63 days or longer, then CMS will assess a late enrollment penalty. It's going to be calculated, be result in a monthly amount that again would be applicable per person and added to any Part D plan that you have or ever get in the future. And that monthly amount won't go away. That'll be a penalty that carries forward. But again, it won't apply to you. You don't have it because you do have credible coverage. And with this plan and transition, there's no lapping coverage at all. Your current plan ends on 12/31/24, and the new plan starts 1/1/2025. But if you get the document or you get the letter, you have to fill it out, send it back so that there's no miscommunication and all your claims are paid. Coordination of benefits, same thing. CMS is going to require it, and I already told you you have credible coverage. So yes, you can fill that out. No gaps in your coverage, and yes, you've had credible coverage. So it wouldn't apply in terms of any penalties, but you need to fill out the document so that you're attesting to it, because that's what they're asking you to do. So I talked about silver sneakers before. So we mentioned medical, we mentioned prescription drugs. Now, some of the health and wellness that you are in addition to that. Silver Sneakers is a great program nationwide. It's more than just a free membership to a gym or fitness center. It's also access to online classes and programs that you can take advantage of if you're in a rural area or you're out of state traveling. There's thousands and thousands of the fitness centers and gyms that are available nationwide. In Midland, we looked up and verified there's 5 participating fitness centers just in Midland. For 1125, you'll have a specific ID number separate from your Blue Cross and Blue Shield ID number, but just for silver sneakers. That'll allow you access to all of the programs at no additional charge. There's also, it's noted here on page 35, a tuition reimbursement program you can look into further if you want to be a benefit to someone that you know who's in college or going to be going, where they can get that tuition lowered just by you connecting them to your account and then using the benefit like you normally would. On page 36, some additional benefits. This is not new. The Blue 365, you have that coverage benefit under your plan today, but it is nice to have additional benefits just for being a member, right? You maybe get discounts through being a AAA member. Here, by being a member of the Cross and Shield, you can get discounts at Dunham Sporting Wear. Great Wolf Lodge is up north for traveling. Evola Music, a lot of local as well as national companies. So check the website for an inclusive list of all the places where the discounts are available. On page 37, Medicare Advantage rewards. So this is something that gives you incentive uh, just for taking advantage of the Medicare Advantage plan. So they say an ounce of prevention is worth a pound of cure. So just like getting an oil change or keep you from having to replace your engine, if you take advantage of these free, in most cases, pretty much all cases, your preventative services like prostate cancer screening and mammograms typically are going to be free of charge. You can get incentive, different certificates, and things to use at various retail stores. Blue Cross Coordinated Care. So this is where you have the help of a professional, a registered nurse who can help you if you qualify. Some instances, whether it's having multiple chronic conditions that require me to deal with several doctors or have prescription drugs, multiple requirements for prescriptions, then instead of getting overwhelmed, or if I don't have assistance or help from family or friends, I can use this program if I qualify to get assistance not only with doctor's appointments or prescriptions, but also with things like the social work, behavioral health specialist outside of just the drug if it's needed. On page 39, this lists some additional wellness programs. I talked about the tobacco cessation in the beginning. That's on the far right column, the third point from the top. So that's available and
Correct?
completely anonymous and online. You also have things like Meals on Wheels, where you can
That's
get
great. Thank you very much.
meals delivered to you. Cases like you coming out of the hospital, they want to make sure that you're on the road recovery
Perfect.
and not relapse or back in the hospital.
All right.
So
Thank you.
they'll have
Bye-bye.
free meals delivered to you, so that if you're not able to do the meal preparation, you still won't go without. They also can help with things like non-emergency medical transportation if there's a need and you want to try to schedule that. Next on page 40, as we move towards our conclusion, and we'll be getting ready to take questions in a bit from you in a group setting for these group questions or work out something or work with you individually if it's a private question with your own personal information. But on page 40, it gives you the phone number and dates and times of operation for the Blue Cross Engagement Center for accessing some of those wellness programs we talked about. And then on page 41, it has our member services information along with the phone number, the dates and time, and different access to get to ID cards, claims information, or if you're changing address, you can reach out to them and get your question or answer the assistance that you need. go digital with Blue Cross. So here they talk about the online
Regarding Jonathan.
app and using things
Okay, I don't have, I'm looking on my calendar and it's
recycle properly, cut down on that.
calling about his next shot, it's still
Go
there.
green, go
And
more
I think
green.
that was the only one.
Not Michigan State green,
I don't know that we have a date
but the other green. And on page 43, we want to just thank you. We
Did you see the
appreciate
last
you
date?
attending the seminar. Our goal is then to give you a brief overview of the plan benefits, how it works, and how best to navigate it. For a more comprehensive
17.
list of the benefits and information, see your benefits at a glance, and for even more detailed explanation of benefits. So with that, we'll open it up. We'll go to the chat as well as look to see who might either raise their hand or let us know that you have questions, and we'll work through them systematically to try to address everything.
So did someone call?
So it looks like there's quite a few questions in the chat. Let's see if we can get those pulled up.
Have a fasting something or other.
Go ahead.
We had labs before that appointment, yes.
All right.
Fasting labs before then?
Norm, we'll start with you. I am hearing, let me get this.
Yes,
Okay, go ahead, Norm. And remember, please keep questions very generic, not claim specific. Okay, thank you.
yeah, and I'm not sure if you or Bridget would be the party to answer this, but it's been described as a bells and whistles policy, but it was also done for the reason of cutting costs at the county level. So where's the advantage or disadvantage of this program?
So the plan does help with the county's OPEB liability, other post-employment benefit liability. Outside of that, you can reach out to Bridget. Unfortunately, she had to leave the meeting, so we don't have a county representative on right now, Norm. So I apologize for that, but you are welcome to give Bridget a call. So some bells and whistles that we've added on that you do have access to as far as the plan is getting that the silver sneakers, adding some for our foreign travel benefits, adding some additional benefits that Medicare and the group plans didn't cover across the retirees. So I'm not sure which plan you were in to speak specifically because there were multiple plans there, but those are just some of the items in addition to the preferred pharmacy network, which does reduce a lot of members' copays as well too. Do you have plan specific question?
I don't know.
Okay. All right. So I apologize that Bridget's not
That's
on
okay.
anymore. All right. Dina, I see your hand raised and then I'll look at the chat as well.
And so I don't want to mess that up.
Dina, if you are speaking, you just need to find the microphone. There you go, and unmute
I
yourself.
was lowering the hand first. My name is Deanna. Deanna.
Thank you.
Yep. And with me here is Ellen Giffant, my wife. She is a retiree from Midland County,
Okay.
retirement disability. And so say hi, Ellen. Hey. I'm the one that usually handles, like all of our dealings, but so if you don't mind, if I can ask the questions.
Sure, not a problem.
All right. So as I said, Ellen is retirement disability. And she had broken her back in 2013, but everything, a couple years later went through. She's had Medicare Part A, as well as Blue Cross Blue Shield through Midland County. And she was supposed to, after like 90 days or whatever, the Part B. And apparently, Social Security, just a couple weeks ago, SSDI, because Craig Maxwell was like, hey, you need to get your Part B before all of this Medicare Advantage goes into play. So she went down to the Social Security Administration office trying to get everything in motion. And they admitted that they made a mistake and opted her out of Part B. So we couldn't get in before December 7th, her Part B active, even though they made the mistake. And they are saying now that she'll be enrolled in Part B January 1st.
Okay. And you have not received a copy of that card yet for Ellen?
Well, she has her Medicare
Part A.
Part A.
And we do have a copy of that, but there will be a new card that comes with Part B,
Yep.
and we'll need a copy of that card ASAP. So as soon as she gets that, the county will need a copy of that card. We are aware that she's not currently enrolled in Part B, and we have noted that with Blue Cross Blue Shield. So yeah, as soon as you have that card, get it to us. Okay?
So, and she knows that, to get the Medicare Advantage, she has to have the Part B in place. So if her Part B goes into effect, which it's supposed to January 1st, then how does the transition happen with Medicare Advantage?
Yeah, so as long as we get a copy of that Part B card or the Part B information, which, by the way, Social Security, the Social Security office should be able to give you a copy of what that Part B effective date and the number is for that Part B coverage ahead of time.
Okay,
So-
I guess I thought it was January 1st, but they'll process it in January and it'll be effective February 1st.
Oh, it'll be effective February 1st. Okay, so we are aware of that. We can put her in what's called a safe division until she has a copy of that card. So, Melissa, if you would write Ellen Gaffant 2/1 effective date. We've got that noted, and so she will continue with her existing benefits for January, and then she'll be transitioned to the Medicare Advantage plan for February 1st. But as soon as you get that Social Security card, get that to us, okay?
All right, that
No
sounds
problem.
great. And then I apologize that I'm trying to make these quick and not too involved, like you said, but I am currently covered under her plan as her spouse under Blue Cross Blue Shield.
Mhm.
I am not retired. And so what happens to my insurance?
Yeah, so first of all, are you Medicare eligible?
No, nope.
You're not. Okay. So what happens for someone who is not Medicare eligible is we actually split the contract. So that benefit will continue as is. There won't be any transitioning for you. You'll keep your same ID card. You'll have access to those services. Once you become Medicare eligible, though, the requirement would be that you, in order to continue on Midland County's coverage, that you be enrolled in Part A and B, and then you would have access to that Medicare Advantage plan.
Okay, that's awesome.
Okay.
And will my premium go up from?
I don't know the information on premium, so I will tell you for the spouses who are paying for health insurance, the cost of the Medicare Advantage plan is less than the existing coverage. So, but I don't know what the rules are, how you retired from the county as far as your contributions once Medicare age is hit, or what union you're a part of. So I can't answer that, but that can be asked of the county directly, okay?
Okay, sounds good. Thank you very much for your time. Appreciate it.
Yeah, you're welcome. So, Mary, I am reading in the chat. I'm hearing everybody muted, so I hope you are as well, but it says you already have an online account for the current plan. Do you need to re-register with this new plan? If yes, what happens to the old account? Michael, does it just transition if they're already using the Blue Cross? And if they've already registered at Blue Cross Blue Shield, does it just transition to the Medicare Advantage Blue Cross, or do they need to re-register? I've never been asked that before.
Say it again.
So under the existing coverage today, she's already registered for the Blue Cross online account
Online account for.
for the app and everything. Yeah.
Okay.
So when January 1st, will she have to re-register, or will that old account transfer over?
I'm not sure.
I think you may need to re-register because your your contract number may be new. You can try to log in as of 1/1, but just thinking about how the numbers are in the system, you may have to re-register. And you'll know that whether or not you can access that account on that day, Mary. The old account,
And all my old records won't be available to me because I have everything online. So all my old Blue Cross
as
Blue
far
Shield.
as her old EOBs, can
Where-
we find that answer out? We'll check on that, Mary. I've never been asked that in 15 years of working with Group Medicare Advantage. So great questions. All right. And then we will get that answer to the county for you too, Mary. Okay. By the way, after this, anyone who's registered for the Zoom sessions will get a copy of the PowerPoint that we reviewed today. In addition, Bridget is going to also try to give you all access to the recording of this call as well. So if you want to revisit it or re-listen to it, you'll be able to do that. S. Bloomer, currently use OptumRx for mail order prescriptions. Are they considered a standard or preferred pharmacy? Michael, is Optum mail order considered preferred? I think
well,
is it just the retail pharmacies that have a preferred? Yeah. I think only the retail pharmacies are considered preferred.
yeah,
Yeah, I have not heard or seen listed that Optum RX mail order has the discounts. The benefit of doing mail order is typically you're doing a 90-day supply, so you do get the buy two get one free as far as months copay that you pay with that. And Michael's researching that as we go forward. Let's see. Oh, dental and vision. So for those who are Medicare eligible under the county's plan, you do need to re-enroll in dental and vision every single year. If the county does not receive an enrollment form, you won't be re-enrolled in those services. For those who had coverage not yet Medicare eligible, that should be automatic. So as far as Ellen's coverage, Deanna, she needs to fill out those forms for January. Well, when is she 65?
10 more years.
Oh, 10 more years. Okay. Then it should be automatic. You should automatically get it. You should not have to return those forms. Okay. I think it's the Medicare age that it becomes a voluntary plan that you'd have to pick up. Okay.
Because she's retirement disability. So
Yep. And I think it's age 65 for the dental and vision.
okay. Thank you.
Anyone else have any questions? You are welcome to unmute yourself. There is a microphone that has a red line through it. And if you wanted to look at that, you can click on that to make yourself green. And S. Bloomer, the prescription tier coverage chart indicates standard mail order and a preferred mail order columns. I think the preferred refers to the 90 in the mail order columns. It's really a 90-day. In the industry, we call 90-day supplies the same as mail order, even though you could get it at a retail or a mail order pharmacy. So I don't want to say yet that it's preferred. I didn't see the prior authorization question, so I'm going to scroll back up to see if I see that. Oh, how do you inquire about prior authorization for a benefit or service? So typically that's handled on the back end by the doctors. So if you wanted to review the prior authorizations that you currently have, you can download the Blue Cross Blue Shield mobile app or go online and you can search under your account for existing prior authorizations. So that's how you would know. In going forward with medication, prior authorization happens behind the scenes. Usually you would be denied a script, and then the Blue Cross Blue Shield is asking the medical doctor for additional information for that approval. Medications can only be approved up to 1 year at a time. On the medical side, again, that's typically something that's happening behind the scenes with the doctors, and they won't even perform a service or do the service until a prior authorization is in place. But if you wanted to check existing prior authorizations, you can do that in the mobile app or online under your account, looking for prior authorizations. I don't see anything else in the chat, and I'm not seeing anyone else raise their hand or unmute themselves. We really do appreciate you attending today, and do watch for that email coming from the county with additional information. In the chat, we did put our phone number, 866-421-0478. And I think that is it. We appreciate your time. Thanks so much, everybody.